We're live. Great, we're live. Hi, everyone. Welcome to our first Google Plus Hangout with the Script Your Future Medication Adherence Team Challenge winners. The Script Your Future campaign was launched three years ago in 2011, and it is a national campaign that has multi-stakeholders and is designed to raise awareness about the importance of medication adherence for people who have chronic conditions like heart disease, diabetes, asthma, and other respiratory illnesses. Too many Americans don't take their medicine as directed, and that leads to a number of avoidable health consequences. In fact, poor medication adherence costs our nation over $300 billion in healthcare costs every year. Our 3-year campaign works in cities across the nation to help raise awareness of this issue. And part of that work is our Team Challenge, which we are talking about today. The Medication Adherence Team Challenge happens every year, and it is a month-long challenge that it is a month-long challenge that has a number of teams. Sorry, there was background noise. Sorry. So we have student pharmacists, nursing, and students from medicine that all work together in a team during the month to use our materials and our information to reach their consumers in their community about this issue. So today we have the representatives of each of the winning teams from this 2014 Team Challenge. And so we are so pleased that all of them could be here today to talk about their work and also what they did. I wanted to also thank our Team Challenge sponsors, the American Association of Colleges of Pharmacy, or AACP, the National Association of Chain Drug Stores Foundation, the American Medical Association, the National Community Pharmacist Association, the American Association of Colleges of Nursing, and the American Pharmacists Association. So the Team Challenge this year alone had over 2,200 healthcare professional students and their faculty that participated. They held over 300 events in 26 states and even the District of Columbia. We counseled 9,300 patients directly, and their reach totaled over 6 million consumers nationwide. We had 109 participating colleges of and schools of pharmacy, medicine, and nursing, and other health profession schools. And so we are really thrilled that we had such a great reach and number of people participating. Now I'd like to introduce Lynette Bradley Baker from the American Association of Colleges of Pharmacy, a lead partner in the Team Challenge. Lynette?
Great. Thank you so much, Diana. Good afternoon or good morning to some of you. Very pleased to be here at our first live Google chat to bring you words of greetings on behalf of the American Association of Colleges of Pharmacy. I just wanted to briefly go over some of the primary reasons why AACP has been involved with partnering with the National Consumers League regarding the Script Your Future campaign. The first one is one that Ayana touched upon in her introduction, and that is that medication adherence is an important aspect of what our future healthcare practitioners are learning. Facts that I'm sure we all have read before include the fact that an estimated 1/3 to 1/2 of patients in the United States do not take their medicines as prescribed. Non-adherence does result in many avoidable outcomes, avoidable hospitalizations. Research does suggest, as Ayana mentioned, that costs resulting from non-adherence may be as high as $300 billion annually. And certainly research has shown that non-adherence is due to multiple barriers that patients face, and therefore multiple strategies as well as a diverse group of stakeholders needs to be involved with helping to combat this challenge. Second point is that medication adherence is an important part of the entire context of patient safety. Safety in its simplest form simply means the absence of harm. And safety is relevant when a medication's role and function saves a patient's life or at least prevents further harm or illness. It's estimated that at least 15% of the nation's population are estimated to be high medication risk patients and may need special coordinated care delivery systems with clinical pharmacy services. The Patient Safety and Clinical Pharmacy Services Collaborative, or PSPC, which is sponsored by HRSA, is an effort to improve the quality of healthcare across America by integrating evidence-based clinical pharmacy services into the care and management of high-risk, high-cost, complex patients. Medication adherence is an integral part of the care and the management of these patients to be in a service delivery system to help make them safe and to conform to their safety and health. Safe and effective medication use and medication adherence are important aspects of patient safety and require the use of collaborative healthcare teams. And that brings me to my final point, and that is that AACP is committed to interprofessional education and collaboration, and the Script Your Future Team Challenge definitely assists with these efforts. Interprofessional education occurs when students from two or more professions learn about, learn from, and learn with each other to enable effective collaboration and improve health outcomes for patients. In 2009, AACP joined 5 other national health professions associations, those in nursing, osteopathic and allopathic medicine, public health, dentistry, to form the Interprofessional Education Collaborative, or IPEC, to promote and encourage constituent efforts that would advance interprofessional learning expectations to help prepare our future clinicians for team-based care of patients. In 2011, IPEC released the core competencies for interprofessional collaborative practice, and since then, a number of state-of-the-art faculty institutes have been conducted in order to provide the focus on advancing high-quality, team-based healthcare delivery. In closing, we are at AACP have enjoyed partnering with the National Consumers League as well as the steering committee members that Ayanna mentioned in her introduction, and we look forward to continuing the work to help improve the patient's care outcomes. So with that, I thank you all for participating and dialing into the Google Hangout. I look forward to the discussions that will ensue, and I'll turn it back over to Ayanna.
Great, thank you, Lynette. That was a really great summary and lots of information about why this challenge is so important and why working interprofessionally is really the key to improving our nation's healthcare overall. So thank you. Without further ado, I think I'm going to go ahead and introduce our speakers today. So first, I'd like to introduce Ashley Ramp from the Lake Erie College of Osteopathic Medicine School of Pharmacy, whose team won the National Challenge Award for their work in this past year. Ashley?
Hi everyone, and thank you, Ayanna, for that introduction. We are proud participants. We have been for 3 years, and that really helped us this year because we've been continually building upon what the past students have done before us. What we did this year that was a little different from previous years is we tried to have school-wide campaigns. So LECOM, for those of you that don't know, we have 2 campuses that we're working together. We have a Bradenton, Florida campus, and we have a campus where I attend in Erie, Pennsylvania. So we wanted a couple of different overarching campaigns to facilitate the continuance of the same message, in addition to the Take Your Meds message. So we, take the pledge to take your meds, which is the overall message. We had a school slogan, ensuring a healthy life through medication adherence, and we really pushed that, asked all the clubs to use that in addition to the branding that the Script Your Future campaign gave us. We also had a public service announcement. We did one last year, and we filmed that, and it was broadcast on local TV stations, both in the Bradenton area and in the Erie and Pittsburgh areas. But we also played it in movie theaters during, before the previews for the movies. So that was a way to really get our message out to a lot of people, a captive audience. And we felt that that worked really well in reaching. I had several people from the community say, oh, we saw that PSA, it was really great, and it seemed well received. In addition, school-wide, we did Script Your Future logo pillboxes that we gave out at events. They kind of acted as initiation of conversation. I think everyone likes free things, so it was really nice to be able to hand those out, and it got patients to interact with us a little bit. In the past, we really targeted big audiences, you know, sporting events and mall health fairs and things like that, which are a great way to get patients involved. But what I challenged the presidents to do this year is to have more meaningful one-on-one conversations, and we thought that the pillboxes were a way to be able to get that message across and get that interaction. And lastly, the last thing I wanted to share was our social media outreach. This was the first year that we really had a big push on social media, and what we tried to do was through our school Facebook page and our school Twitter account, we asked each club to create a message about their event. So, you know, the day of the event, make a little message, come see us at this mall, at the health fair, we'll be doing free blood pressure screenings or something along that line. And then also, in addition, as a follow-up, to put up some kind of article that was patient-friendly, that could be a resource for patients to use, that was more informational based. And I'm sorry, I forgot to touch on it. The way that we made sure that we had collaboration between interprofessionals was we paired each of the clubs from the pharmacy school to the medical school, and that way we had constant participation and communication.
Great.
Most of the other stuff I'll touch on the questions.
Great. Thank you so much, Ashley. That was really a good summary of what your school did. Thank you. So moving right along, I want to introduce Megan Elesky, who is from the Northeast Ohio Medical College School of Pharmacy, and her team won the Media and Communication Outreach Award, which was a new award this past year. So, Megan?
Okay, hi everybody. Thank you, Ayana, for the introduction. So, as she said, I'm from the Northeast Ohio Medical University in Rootstown, Ohio, near Cleveland. So our purpose or our focus for the Take Your Meds, or Take the Pledge, Take Your Meds, we wanted to obviously raise awareness throughout the community about non-adherence. Specifically, we felt that our community shouldn't be limited just to the Northeast Ohio region, but to the state itself. So we specifically targeted an early foresight that we looked into was to get a statewide proclamation through Governor John Kasich for a specific Take Your Medications Day. So by getting a specific day nailed down during February 15th was for us, we were able to raise community and statewide adherence. Through this prompted obviously other media outreach, as well as we did have most schools of pharmacy in the state of Ohio on board with us, working with us. So with this, our team consisted of 3 advisors. We had a core group of about 37. It was an interdisciplinary team. We have a med school at NeoMed, so 37 medicine and pharmacy students. And we also worked with, obviously, the other pharmacy students, colleges of nursing in our area that we affiliate with, and then the podiatry school in Northeast Ohio. Specifically for media outreach, what we looked into, the Governor's Proclamation was the biggest one by far. But then this also sparked what we led into for different things. So we ended up getting support from Ohio Senator John Euclid and Ohio Representative Kathy Clyde. They were contacted and also approved their support for the initiative. For media coverage, we were fortunate enough to be featured in 4 different print magazines around the area, so Akron, Cleveland, Massillon, and Canton area focused us. We were invited, our faculty advisor was invited to do a radio interview in Akron. We used, thankfully, our support staff at NeoMed was great. They focused us on the NeoMed website, and then we also got out through social media. So the support staff at NeoMed helped us to create a PSA, which ended up, we put on YouTube, and the school website also posted it. And then we also used Facebook and Twitter to really get the message out and to reach our participants. We'll go into this a little bit later about the results as well as the specific programs that we had, but the media outreach really helped to prompt those we had 4 big events during the month, 3 big events during the month that we really used the media coverage to expose that to get contact with our patients. So thank you again. I'm excited to be here and hear the rest of what the teams did.
Great, thank you so much, Megan. So let's move on to Amy Tiemeyer and Matt Siu at the St. Louis College, who also won a national team award for their work during this past year. Amy and Matt? Or is it just Matt? Oh, great.
Rose here.
Okay, hi.
Everyone. We'll go into a lot more detail later this hour, but our theme this year was Let's Talk St. Louis, in addition to the national campaign slogans. And so we use that as sort of like a starting point for conversations when we approached patients at health fairs, at various events. That was a good conversation starter. And in addition to the Let's Talk St. Louis slogan, we came up with a sort of a mnemonic device. So the sort of like the sub-slogan was ask your healthcare professional how they can help. And each of those letters in the word help stood for something. So H stands for how you take your medicine. E stands for expectations for your medicine. L stands for living a healthy, longer life. And P stands for paying for medicine. And so we use these in our flyers, in our materials, and our videos. And we targeted each of the disease states by looking at unique issues related to each of those letters concerning diabetes, hypertension, and asthma. And so we'll get into that later this hour. But our team consisted of pharmacy students here at the St. Louis College of Pharmacy, PT, OT, medical students from the Washington University School of Medicine, and nursing students from the Goldfarb School of Nursing here in St. Louis. We originally had a goal of 28 events in 28 days of February, and we ended up doing 29 in total, and we reached over 8,000 patients this year and counseled 1,200 of them. And we attended numerous health fairs, performed health screenings, mostly diabetes and blood pressure, and we did those at community pharmacies as well. We had a table at athletic events. We used our materials in ESL classes. We translated some of the materials so we could do some of our events bilingually as well. We went to church services. We actually even hosted a cooking class and visited a couple of long-term care facilities. And so I'd be happy to answer any questions related to those events.
Great. Thank you so much, Matt, for detailing your work. So let me move on to Jasmine Ruber at Torrey University, California School of Pharmacy. Jasmine, oh, wait, so your team also won the Health Disparities Award, correct? So please tell us about that. Oh, no, you won the National Target Market Award. My apologies.
Hi.
Yeah.
So, yes, thank you for the introduction. I'm a pharmacy student at Torrey University in California. And so a little bit about our school. We have other colleges. We have a College of Medicine. We have a public health program, and we have a physician assistance program. And just this fall, we just started a nursing program. And for our Scripter Future Challenge, our focus was to, this is my second year participating, so we had focused to not only educate the patients that were like non-adherent, but we wanted to make sure the other colleges, the other students from these other colleges were also educated about non-adherence as well. And so in total, we held about 6 events. We had 64 students, pharmacy students who volunteered about 1,400 hours, and we did outreach events we try to make them as innovative as we can. We did a San Francisco ferry event where we went to the ferry station and did outreach for the people going to the ferry, because people take the ferry to go to work or to go to baseball games or to even just go visit San Francisco. We also held Scripter Future campaigns where we talked to patients and passed out materials at Vietnamese New Year's, because in California we have a very high Asian population, and we had students translate and do blood pressure screenings and counsel them on their medications and perform medication therapy management. And the interprofessional component came from our student-run free clinic, where we worked with, under our medical faculty, Dr. Pierce, we worked with medical students and PA students in providing healthcare services to patients. And we all actually worked together to do the Script Your Future campaign, and just not pharmacy students, you know, talking to patients. We actually worked together with next to a medical student or a physician assistant student. And then we did a Valentine's Day outreach event where we gave Valentines to other medical students and other pharmacy students and public health students. And in our grant, we put in materials for them to take to their rotation sites to dispense these materials at a hospital that they work at, or a clinic, or a community pharmacy. And then the last two events, one was in Berkeley. We do a lot of community outreach as a school to the men's shelter and the women's suitcase clinic, where we have homeless people. When they come in, when there's something is wrong, or if they're taking something, we can also talk to them about medication adherence as well. And I'll go more into detail into these events later during the Q&A. But we did work with like patient literacy, and our big focus in this campaign was working together as a team.
Great, thank you so much, Jasmine. So last but not least, I want to introduce Tori Grover from the University of Wisconsin-Madison's School of Pharmacy. Their team won the Health Disparities and Underrepresented Community Outreach Award for their work this past year. So Tori?
Thank you, Ayana, and thank you to everyone that is watching. My name is Tori. I'm a pharmacy student at the University of Wisconsin-Madison. The 2014 Medication Adherence Challenge was the first time the University of Wisconsin participated, so I speak on behalf of all those involved that we are very excited to have won a national award, and we definitely hope to build on this success in the upcoming years. So our interventional program was based on community outreach and patient education targeting local underserved populations. And the student group involved is a recently established interprofessional health group on campus. The group was formed as kind of a grassroots effort by students that really wanted more interprofessional experiences during their time as a health profession student. So the group was formed in 2011 and comprises 15 different health profession programs on the University of Wisconsin campus, and our mission is to really help students learn the necessary skills to collaborate within a healthcare team. So our faculty advisor for the group is a pharmacy faculty advisor, and he's the one who brought up the idea of participating in the Medication Adherence Challenge. And the challenge was the first community outreach effort that was undertaken by the Interprofessional Health Group. So another student in public health in their second year of public health program joined me as co-chair in coordinating all the events for our first time participating. And the largest portions of the participating volunteers were pharmacy students. Other health profession students were involved in the outreach activities, including public health students, physical therapy, dietetics, as well as medicine. The majority of our events were based on one-on-one interactions with patients, and that's kind of unique as I am learning to find out about the other teams that have participated. The only thing that wasn't a one-on-one interaction was our public service announcement. So what we focused on was counseling patients with the Script Your Future materials that were provided and assessing their adherence behaviors at local free food pantries, free clinics, as well as free pharmacies. So the specific process that we had in place in the Madison community was having student volunteers set up all the provided materials from Script Your Future, including the wallet cards, stickers, and posters. And then the student volunteers approached patients that were waiting in line to either receive health care, food from the food pantry, or medications from the free pharmacy. And the student volunteers were instructed and trained to establish rapport with each patient before they started to discuss medication adherence, attitudes, behaviors, and health conditions. We provided the student volunteers with a questionnaire that served as a basis for this conversation, with all the questions that we asked patients, as well as sort of a script with all the necessary information to provide to patients. So as our first time participating, in the 4 weeks of February, we coordinated 29, possibly more events, and approached 293 patients, counseling 199 of those people with a specific focus on the underserved patient populations.
Great.
Yeah, so I'll be happy to answer any questions that the viewers may have.
Great. Thanks so much, Tori.
Yeah.
Thank you to everyone. So let's get into the Q&A portion. I've got a couple of questions that I wanted to start off, but we obviously want to take some from the audience. So the first question I have for everyone, so medication adherence is a really complex topic, and it's one that many people haven't actually heard of, let alone understand why it's important and why it's impacting their life. So I wanted to direct this question to Matt at St. Louis. How did you all take this topic and distill it down to something that the average consumer or patient could actually understand?
All right, that is a great question. As I said before, we created disease-specific flyers and videos for each of the targeted diseases, so hypertension, diabetes, and asthma. And using that the HELP, we asked ourselves what the biggest potential barriers to adherence were for each of those diseases. And so, like, if you think about it, for example, when it comes to asthma, it's most likely administration. Are they using the device properly? For hypertension and diabetes, it's, are these side effects normal? Which are the side effects that I need to look out for? When do I need to talk to my doctor or pharmacist? When do I need to follow up? And so we created these flyers, and we took them to our health literacy committee here at the college, and they worked with us, and we used something called a suitability materials assessment, otherwise known as, I think, a SAM. And that's sort of the gold standard in health literacy. And it took us about 5-6 edits. We worked back and forth. It took a very long time to work on the language, because when a patient gets information, you want it to be as simple as possible. You want to use plain language principles. And so that was our initial approach in creating those materials. So all of our materials were eventually approved by this committee for plain language standards.
Great, thanks so much, Matt. That really is really interesting, because that was one of the follow-up questions I was going to ask. How did you make sure that your materials were health literate and that people could understand it who had low literacy? I know Tori at University of Wisconsin, you guys also dealt with this. Can you talk a little bit about sort of how you were able to make your messages understandable to different populations? And even Jasmine, I think you could also address this question as well, because I know you all reached out to people who spoke other languages besides English.
Yeah, so at the University of Wisconsin, how we dealt with the very complicated topic of medication adherence was to create this questionnaire for student volunteers to complete with our patients. And the questionnaire really focused on 3 main ideas that we wanted to get across in regards to medication adherence. We used the Script Your Future posters for information about cost savings that is associated with adherence. And then we also used the Script Your Future medication wallet cards to explain how managing medications happens and how the wallet cards could remind patients of refills and also protect them in emergent situations. And lastly, we used the Merck adherence tool questions and provided any feedback if the patients brought up any concerns of safety, importance, or financial burdens associated with their medications. And we found that a lot of the patients we talked to were Spanish speaking or Hmong, and some of our student volunteers were able to translate. In the future, we will have the questionnaire pre-translated, but we ended up doing that actually a couple days into the challenge, because we realized how important it was that we can be able to communicate with those patients that are Spanish speaking, among other languages.
Great, thanks so much, Tori. I will move on to another question unless anyone else has something to add to this, because I know you all did the work of taking a really intricate topic and making it something really simple. So one thing that we have done here at the National Consumers League is also to create our materials and take them and put them into different languages. So we also have our wallet cards, which help people track their medicine and know which questions to ask to their doctor, and that's available both in English, Spanish, Hmong, Chinese, and Vietnamese. And then we also recently launched a Spanish web page on our site. So for those of you who work with populations that speak anything else besides English, please check out our website and our different resources. And then you can use that and also recommend it. Something that's really great about the challenge is, actually for us, I can't remember which school it was, but some school actually took our materials and translated them into Spanish, and that's how we got our first version of our Spanish-speaking materials. So, that's something that's really great, and that's why we love working with students, because you guys come up with really great ideas. I know, Jasmine, you all took your stethoscopes and jackets and went to the San Francisco Ferry and actually talked to people who may or may not have actually been wanting to get health information. How did that work, and how were you able to do that?
So this was actually an idea originally from, he's a second-year pharmacy student, Timothy Fan, and he said that, the people that come to the pharmacies, those are the people that are adherent, because they're coming in and they're refilling their prescriptions and they're taking their medications. And so we wanted to reach a population that would often maybe not go and get their medications, and most of the people, there's always a reason, whether you have work, you have school, there's other things going on in someone's life. And so we decided to go on the ferry because you get such a wide population. You get people going to work, you get people going to school, you have old, elderly people like visiting the area, forget their medications on vacation. So we went to the ferry. We actually sat on the ferry, and then we actually set up a little station, and we went to the different people sitting on the ferry that wanted to know what we were doing, and we were saying, oh, do you take medications, or do you have high blood pressure? And then we would talk about why it's important. Like, do you have your medication? Do you know the name of your medication? And we gave them these wallet cards and said, if something were to happen to you and you were in the hospital, someone can even use these wallet cards to see what medications you're on and help you. And you can't even, maybe relay any important information. So these are actually tools to make them healthier and actually maybe to save their life. Our advisor who runs this program, she's Hmong as well, Dr. Lore. She does a lot of outreach events, and she actually works at a clinic in a Spanish-speaking community. So we also worked with making patient literate material, as well as not just the language barrier, but just breaking down what it means to be adherent. So instead of hypertension, we may say blood pressure. Instead of glucose testing, we sort of make it very patient friendly, and we try to approach it where if they're non-adherent, because the first thing when someone doesn't take their medication is they don't want to tell you they're not taking their medication, and then they don't want to be lectured about not taking their medication. So we really worked with trying to motivate them and making health a priority for them.
Great, thank you. So I just wanted to pose this question to everyone. I think that either Ashley or Megan could answer this one well, but based on your experience with patients in the community during the challenge, what do you really think is the biggest obstacle to medication adherence? And secondly, is this something that is different from what you thought before you actually were doing the challenge?
I think one of the biggest obstacles to medication adherence is just that patients don't really think it's that important. Symptoms of hypertension they might not have. They might have went to the doctor and they said, you have hypertension, we're going to put you on this ACE or this ARB, and that really doesn't mean anything to the patient. They didn't feel bad when they went to the doctor. They don't feel bad now. They kind of are unsure why they need the medicine to begin with, and they don't see long-term, and maybe it was never explained to them long-term how it can help them and why it can help them. And even though they're not feeling the symptoms right now, it can prevent things later on down the line. I think during one-on-one patient interactions, that was the main thing that we felt came up as the barrier to medication adherence. So as pharmacy students, getting out there and spreading the word, and sometimes even breaking down the mechanics, as Jasmine said, into patient-friendly terms, really helps them to understand why it's important to take their medications. Personally, before I started participating in Scripter Future during my first year, I thought the biggest barrier would be monetary costs. So yeah, it's definitely different from what I thought, and what's great about that is we as professionals can help them to overcome this, what I think is the biggest barrier to a lot of patients.
Great, thanks. That's a good, yeah, that makes a lot of sense. Megan, did you want to speak on this as well?
Absolutely. I think Ashley brought up some great points concerning where we can as pharmacists step in. I'd also like to say about, I really think it can be an active role in which pharmacists can play. Obviously, we are more of a proactive role into communication-wise. So I think where we as a profession can improve for adherence, which Scripter Future really, I think, upon reflection taught me as well as the rest of the team about, is the importance of listening. Ashley said you would have thought the biggest thing was monetary. A lot of ours came up with side effects being an issue, belief systems being an issue, maybe not having an organization system. So I think the key thing to remember as professionals in which we can improve to help our patients improve on their adherence is to really use key listening skills and key interviewing skills to see what the breakdown in the problem is for adherence.
Great, yeah, that makes a lot of sense. Great, thanks so much. So I have another really interesting question. And so I want to direct this again to Megan. So all of the winning teams engaged in really unique and creative projects. And of all of the activities that you all accomplished, what would you say was your most creative outreach activity?
So for outreach activity, I would say, so we had 3 big events during the month of February, really spurred more by, I would say, our ability to get the Governor's Proclamation and really unify all of the schools of pharmacy, or most of the schools of pharmacy in the state of Ohio. So when I say outreach events, I mean ours specifically that we held, but most of the schools of pharmacy actually ended up holding events themselves. So thankfully we had the full state initiative behind us. We were great in that we, as other schools did, we had community outreach at malls, but then we also kind of took a different role in that we went to the Great Lakes Science Center, which is in Cleveland, Ohio, and we did more of an outreach because we figured if you're going there with your kids, you're going to have some free time. So we ended up doing events with the kids, so we ended up compounding capsules that kids do, and we had coloring events related to medications and not use or take medications without your parents knowing. And then while the kids were occupied, the parents could sit down, we could do blood pressure checks, we could do counseling and adherence strategies for that. So I think, again, though, it all comes back to that we were really fortunate enough to have that Governor's Proclamation and the support of the whole university in order to get that done.
Great. So Ashley, you all, this is, I think, LECOM's 3rd time being a part of the challenge, and you have 2 different campuses where you're doing that work. If you had to pick one, what would you say was your most unique piece? And then Matt, I want to pose this question to you as well.
We did one, it's really hard to pick one, I think, especially between the 2 campuses, but the one that I thought was the most personalized was we did a heart Valentine's Day card sale where we sold the Valentine's Day cards in the cafeteria here, and the students could address them to their family and their friends and add personal messages about medication adherence. We really felt that that personal message coming from them really would help to spread the word of medication adherence. And we charged, I want to say it was $3 or $4 per card, and then we donated all of that money to the American Heart Association as well. So I thought that was really creative, a little bit different from our other activities that we traditionally do with Scripter Future.
Oh, that's really neat. Yeah. Matt, did you want to add on to this piece too?
My favorite event that we did this year was we partnered with a community health organization here in St. Louis called Casa de Salud. and they run sort of a low-income flat rate clinic, but on the side they also have like a community center where people who are interested about improving their health can go, and they host events, and they cater primarily to a Spanish-speaking population here in St. Louis. And we sort of co-hosted a healthy cooking demonstration. And so there is a registered dietitian and nutritionist who sort of gave a presentation on sort of healthy eating habits and how to cook like a healthy dinner at home in like 20 minutes. And while they were cooking, we gave the presentation for Script Your Future that we translated. And so that was my favorite event, mostly because it was multilingual, and we got to access a population that really wouldn't have sort of the opportunity to hear the message from Script Your Future. So.
Great, yeah, that's really interesting. Oh, cool. Thanks for sharing that with us. So I want to move slightly in a different direction, and let's get into the planning. So can you give us a bit of the insight into how this worked at your school? What was the planning process? You know, for instance, how did your team decide on what the theme would be, or who your audience, who you would focus your outreach to? Let's Jasmine, do you want to answer this question? I'll direct it to you.
Sure. So I wouldn't say it was just like a team and I was on one team. We actually had all of the entire school participated, and then we made mini teams. So we would make, if one team was like, we had the Vietnamese club saying, you know what, the Vietnamese New Year's coming up, here's what we're going to do. We're going to translate, we're going to do blood pressure screenings, and then we supported them in any way by marketing that event. But they would run it, and then we try to open this opportunity for first, second, and third year students to sort of put their own touch to it and make it a personable event, something where they can make it their own. And then I did the San Francisco Ferry. We all met after the holidays, after the Christmas, stress is over from shopping, and then we all met and we all had thrown around ideas. Each club had their own perspective. We have a free clinic where we do services, and we actually had to go into the other colleges and try to understand like what their role of how non-adherence affected them, and try to make an event where we included everyone. So not just pharmacy. We met several times, and then we ended up we had like one person in charge of like the grams. We gave grams to each other, and the reason why is we always want to foster interprofessionalism, and it just doesn't have to be in the workplace. It could be just knowing someone, and because we're going to be working with them as healthcare professionals. So those were like some of the few events that each team had worked on, and then we would regroup, and if we came into any obstacles or any problems, we tried to help each other. And it necessarily wasn't just their event, it was like our event. And I think that motivation is probably why we were so successful of all the events we've done.
Great, thank you. So Tori, you mentioned that this was the first year that your school participated. Can you give us a little insight into how far in advance did you guys start planning? Any difficulties or barriers you encountered being it your first year?
Yeah, definitely. That's a great question, Ayana. So as our first year competing, we really didn't know what to expect, and we had nothing to go off of from previous teams competing, and we actually started brainstorming ideas for what we wanted to do all the way back in October. So we toyed with many different ideas of who we wanted to educate in the community, like whether that be older patients or high school students, and our intentions were to have as large of an impact that was possible and address several populations, but we didn't have the manpower to do so. So we therefore decided to focus specifically on a patient that would really reach the needs of our community. And my advice to other schools that are starting new for the first time and competing in the Medication Adherence Challenge would be to really focus and make sure your entire planning group is aware of your main theme and what you're really aiming at, and really work off of what connections you already have. We reached out to things that the School of Pharmacy was already partnered with, and other interprofessional student-run free clinics. So that really helped us get off the ground running really well for our first year.
Great, thanks for that advice. Yeah, that's a very sound advice, because on my end I get a number of questions from different schools wondering how can they come up with a project within a couple of months, but I think it's really smart to pick a narrow focus and then go from there, and then you can actually have a really big impact, bigger than probably imagined. So I want to just take this time to let everyone who's watching know that if you have questions for any of the teams, go ahead and send them in. You can send them in through the Google Plus page if you're watching it through Google, or on YouTube as a comment, and you can direct it to any of the teams or myself, and we will be happy to answer those questions. So let's talk a little bit about interprofessionalism. So the team challenge is rooted in the schools of pharmacy, but it also has an official representative from all of the other schools. How did you all recruit other health professions to join your efforts, and what were some of the challenges you faced?
All right, I'll go ahead.
Sure, thanks.
All right, we here in St. Louis, we're lucky enough to have a sort of interprofessional group. I think another student mentioned they had one as well. And so that was very easy in trying to recruit manpower. So like in all their events starting in January, we would send out sign-up sheets and be like, we would explain what Script Your Future was all about, and there was a lot of interest. The trickiest issue that we had, for sake of time, was that we had to get permission from the deans. And so just because deans get like hundreds of emails a day, it was somewhat difficult to track them down, but we managed to. So that's just my word of advice forward.
Great, thanks. So we just got a question from the audience, and that question is for those that actually worked in an interprofessional setting. This viewer is interested in learning how other health professionals viewed medication adherence. Do you feel like this working with Script Your Future opened their eyes to the problem of non-adherence? And Jasmine, do you want to take this question?
I can. So we work at we have a student-run free clinic, and so we have all colleges of different disciplines, you know, the PA program, public health, they do a case management program. The College of Medicine, you know, they provide services along with pharmacy students as well as medical professionals that would come in precept and pharmacists at precept. And I remember they know about non-adherence. They know what it is, and I don't think they were telling me, and I didn't realize this, it affects them just as much as it affects us. I remember giving out a wallet card, and I remember one of the people I was working with that was from the College of Medicine said, "These are awesome." And I said, "Why?" And, you know, because I didn't realize, because he wanted like hordes of them. And he said, "You know how many patients come in, and I want to know what medications they're on. And a lot of the time they tell me, you know, it's the green tablet or the blue tablet." And for them, it's such an obstacle for them not only to know if they're taking it the right way, or if it's a medicine they should be taking every day, or if it's a vitamin. So they were telling me that they do take medication adherence seriously, but sometimes they feel that they're very limited in what they can try to get from that patient. And they felt that this campaign was such a great opportunity for them to not only promote medication adherence, but also to get a really good medication reconciliation of patients, and then be able to give them a really appropriate course of therapy.
Great, yeah, that makes a lot of sense. Oh, awesome. Ashley, did you want to add into this question?
Yeah, we worked with nursing students. We actually did a presentation for them, and kind of the same things that Jasmine was saying. The fact that they knew this problem existed, but they didn't know how to go about approaching it and helping fix that. So I think they really appreciated us as pharmacy students and pharmacists reaching out to them and realizing that they were, you know, especially in the inpatient setting, they're the closest thing the patient has to healthcare all the time. They're constantly around. So just the fact that letting the nursing staff know how important it is to make sure that the patients know about medication adherence and just medication information in general. I think it's really important, and we were really well received with the nursing staff as well. I think because we approached it as you are one of the professions that sees the patients the most, and so that's why we really wanted to talk to you, the nurses, about it.
Sure. Yeah, that makes sense. The Nursing Association was our first. This was their first year joining in on the Script Your Future Team Challenge, and so we were thrilled to have them because nurses, along with all the other health professionals, play such a critical role in patient care. So I want to move to another question from the audience. This is directed to Megan at Neomed. So what process did you use to actually reach out to your governors and the members of Congress? That's a pretty awesome feat, and I know a couple of other schools did that, but how did you accomplish that?
So I feel like obviously Script Your Future is a student-led program. We are fortunate enough, though, I feel like we don't express enough gratitude or recognition to our faculty advisors who have been fortunate enough, we have been fortunate enough to work with, as well as Neomed itself, which I didn't even recognize until I worked with Script Your Future as the project coordinator. But we have different support staffs, so specifically we have a government affairs office that work directly and know a lot of our state representatives. So our campus is pretty advocacy-led, so a lot of the students often write letters to our government officials. So between that, the support staff and the government affairs and our faculty advisors, we were able to really connect with a lot of our congressmen and women. In addition to that, I feel like Tori kind of went into this. I think if you're looking to do that kind of intervention or take that kind of step, you really need to see a lot of foresight. So we were starting to plan come October, and that's, I mean, at least, if not earlier, to start planning for the licensing and looking forward to that process.
Great, thank you for that. Jasmine, did your team also have outreach to Congress or policymakers?
So it wasn't just our school, it was actually all the pharmacy schools in California. Every March we actually lobby at the Capitol during our legislative day, and one of the bills that it actually just passed state assembly, it's actually up for Senate vote, is a medication adherence bill where we allow patients to choose whether to get their prescriptions at a pharmacy instead of just being restricted to a mail order. It's actually to improve patients' access to medications. And what we all did is we wrote to all of our representatives, all of our state assemblymen. We made appointments with our Congress members, and we actually went there and went to go speak to their legislative aides. We held a legislative dinner. We invited the legislative aides, congressmen, and senators to sit down so we can address the different bills on the table. And, you know, that included also medication adherence. And so it just passed assembly vote, and now it's up for Senate. And it's not just Torrey University, it's, you know, all the university colleges of pharmacy in California. But we did this as more of as a team effort to try to push for medication adherence in our state.
Great, thanks. So I want to ask for, I think I want to direct this one to both Tori and Matt. How did you all work in the community and actually get buy-in from the different community organizations? So the Script Your Future campaign at the national level has a number of groups that we work with, both grassroots and local, and they're all doing different things. So how did you engage those different groups, and any tips?
Yeah, I can start off with this one if Matt wants to follow me. At the University of Wisconsin, I mentioned our Interprofessional Health Group, and the Interprofessional Health Group pulls from 15 different professional student programs. So we have representatives from each program that are involved in helping create some of these ideas for the Medication Adherence Challenge. So that was really vital in the planning process and brainstorming where we could go out in the community and start talking to patients. So it helped that the pharmacy students had the connection with the free pharmacy and thought that There were already volunteers there, and there were already other community groups sitting and waiting in the patient waiting areas, talking to patients there about other educational programs. And then there was a PT student who brought up the idea of a pro bono PT clinic and talking to patients there. So that was really, really important in how we found different community partners, is just all the connections that the interprofessional group really does have and kind of spans out in a big web.
Great. Matt, did you want to add anything from this?
Yeah, sure. Well, first off, we reached out to all the student leaders, not only in pharmacy, but in all the other health professions, including public health. And that was how we found a lot of organizations in the St. Louis community where there was a need. So we looked for people who wanted us to come and speak on medication adherence, and we tried to find an audience that would most benefit. Most of these organizations were very enthusiastic. The issue came down to scheduling. So I would encourage people to get on the ball more quickly than we did. So a lot of the events that we planned were either pre-existing events or events that coincided with other events that the organizations were holding. I'm not really sure what else I had in mind, but I would recommend coming up with a giant list of all the organizations or possible events that you would be willing to undergo. I would encourage all students to sort of give their input on that list and go from there, and just start contacting people as fast as possible.
Great, thank you. So I want to open this up to everyone, especially LECOM and St. Louis, because you both have participated in previous years, and Tora as well. How did you all build on existing relationships with the community? And I know you all did something slightly different each year, but you did have existing relationships. And so how did you build on that? And then also, what do you plan to do moving forward with some of those groups? And let's everyone take 30 seconds to answer this question.
Going off of what Matt said, I think what was really important that we did was making sure we established far in advance, reaching out, asking for help from the community organizations. But in addition, we really started talking to the student leaders ahead of time and asking to make sure that they make that transition go smoothly. And that not only as student leaders, but also the faculty advisors really play a huge part in making the transition go smoothly, because they're here every year and involved with these programs every year, whereas the student leaders and the presidents are constantly a revolving door. So really make sure you reach out early, and also make sure you have that transition go smoothly. Make sure you pass that contact information and those names down from year to year.
Great, thank you. So we are coming near the very end of our first Google Hangout, and I'm super excited, but I want to end this with one final question to all of the groups. So all of you take 30 seconds to answer. If you had a wish list, what would have been the one thing you guys would have been able to accomplish this year during the challenge? And let's start with Tori.
Sorry, it's just taking me a minute to unmute.
Sure, no problem.
All right. So if there was one thing we could have done differently this year, it would have been to translate all of our materials sooner. That was something we didn't have a lot of foresight into being an issue. I also found it very interesting that the obstacles to adherence were completely different than what I was expecting. And a lot of the people that I spoke with during volunteering really realized the importance of taking their medications as directed, but just simply couldn't afford it. And that is to be expected based on the patient population we reached out to. But many of the patients we talked to were very receptive and really enjoyed talking about medication adherence and all their challenges. So it was overall a really great experience.
Great. So Megan, what would have been the one thing for you?
So I think we're really excited that in Northeast Ohio we like to think that we have pretty innovative healthcare. So I think this year moving forward what we're really going to look towards is to continue to build our interprofessional team. The podiatry school is further expanding. I'd really like to see that nursing gets more involved. With only pharmacy and medicine on our campus, we are a little bit limited in that sense, but we really believe in interprofessional discipline and the action in the team. So we're looking for further expansion with that.
Great. So Jasmine, you've got 10 seconds, 30 seconds as well. What would you change?
If we had a little bit more time because of scheduling issues, we would have liked to done elementary schools and high schools, especially asthma here is a really, really big, a lot of children have it here, and we would have wanted them to show how to use their inhaler. So I think that's the one thing we would like to go is hit those populations.
Great, thank you. Matt, what would St. Louis? Oh, sorry, Matt.
Yeah, sorry, I couldn't hear you.
I was on mute, sorry.
Yeah. Media. That's one of my biggest regrets, that we couldn't schedule a TV appearance in time. And so there are a lot of logistics that go into that. So some schools prefer that a registered pharmacist or a faculty member be present during a media appearance. And so I would plan for that.
Great, thank you. And lastly, Ashley, what would you have done differently or have in your wish list?
I think two things. First, I think Megan was the one who touched on it, but I would like to expand to more interprofessional. We have the medical school, which is great, but I think that because we have them, we tend to rely on them a little bit, and I'd like to expand that to physician's assistants and, just other patient or other professionals who have patient care. But in addition, I would like to see more social media next year. We really tried to initiate it this year, but I think, the first year is always kind of a learning curve. So next year, definitely on my wish list would be more social media interaction.
Great. So thank you, everyone. We have reached the end of our 1 hour time. It wasn't enough to get through all of the different questions and to really engage, but this was an awesome time, and I feel like we all have a lot more to contribute. So, I'm going to open up something that's really neat. We would love to have guest blogs from those schools who participate today, and also who are watching. If you guys wanted to write about any one topic you wanted to touch on, or even address a different issue or some of the challenges and awesome opportunities you guys face while participating in the challenge, we'd love to have that and feature it on our Script Your Future website. So I'm just going to go ahead and wrap up, but thank you, everyone, and especially thank you to the schools who participated this year, all 109 of you, and of course to the 5 of you here and your team leads for all of the great work that you did during the challenge. We've been able to reach 6 million people about the importance of taking their meds and hopefully making a little bit of a dent into our healthcare costs and improving prevention for chronic diseases. So I'm so impressed by all of the creativity and thoughtfulness that each of you displayed and talked about your work during the team challenge. And so, I think the future of our healthcare system is in really good hands. So if you have any more information on the team challenge, please visit scriptyourfuture.org. And you can click on challenge and you'll be directed there, and you can also sign up and join if your team has, or if your school hasn't participated in years past. And we are pleased this year to actually extend the challenge to a full 2 months. In years past, it's only been 1 month where teams have the opportunity to do their work, but this year we will extend it for a full 2 months in the beginning of 2015 so that we can have greater reach and more opportunities to interact with patients and solidify some of your work. So thank you, everyone, for joining and listening in on our call, and I want to thank again our sponsors, AACP, IACN, AMA, NACDS Foundation, the American Pharmacists Association, and NCPA for all of their work and participation. So thank you, everyone. I don't know if Lynette, did you want to say anything or not? But I will go ahead and close the Hangout. So thank you, and it was great to talk to everyone, and hopefully we all learned something really awesome. Thank you.
Great. Thank you.